My name is George Groman, and I'm a clinical cardiologist with Cardiovascular Specialists of Central Maryland. A stroke is a series of symptoms that can show up in many different ways, but ultimately means that there's a loss of some aspect of central nervous system function. And it's due to usually a lack of blood flow to a vital part of the brain, or due to a hemorrhage in that same area. It's reasonably important, though probably doesn't weigh in quite as heavily as it does for coronary artery disease. Oftentimes it may be because the family is prone to hypertension, or occasionally because they have an inherited malformation of vessels called AV malformations, or aneurysms within the brain itself. Well, in this country, the risks for stroke are very similar to the risks for coronary artery disease. So those of us who smoke, or may be diabetic, or hypertensive, or postmenopausal, or are very obese or very sedentary, or who might have very high lipids, are all at risk for a stroke. The added risk is atrial fibrillation, a heart rhythm disturbance that can send a clot to the brain or elsewhere. You know, we have an acronym, it's called FAST, and the F stands for face, or facial drooping. The A would stand for arm, so that there's either weakness or drifting. The S for speech, it can be garbled, or the patient can't really get out their words or can't understand when they're being spoken to. And the T is for time, because time is a factor in trying to do something of a favorable nature for some patients with certain types of strokes. Well, the most recently developed treatment is called TPA, or tissue plasminogen activator. People who have strokes, if they are due to the evolution of a clot within a vessel, or from a piece of thrombus that comes from the heart, can be treated provided there's no bleeding into the brain, and provided their blood pressure is not too high, and provided we get to them within 3 hours, can be treated with this clot-busting drug called tissue plasminogen activator.